So we see it here that in restrictive lung diseases, as we know that the elastic resistance is increased. As the elastic resistance is increased, as we can say this here, comparatively it is increased to the normal. So when the elastic resistance is increased, the work of breathing is also increased to overcome that elastic resistance that usually occur in the restrictive lung diseases. So in order to overcome that, you can see here the respiratory rate is low, but when it decreases here the respiratory rate is getting higher. So in order to overcome the work of breathing that is increased due to the elastic resistance, we have a compensatory mechanism caused by our body to minimize the work of breathing, that is by increasing the respiratory rate. So here you can see that the total work of breathing by increased elastic resistance and normal airflow resistance, this is the total combined work of breathing by these two, this one and this one. So here you can see that this is the value of this graph where the work of breathing is minimal, this kind between 15 and 20. As you can see that the 15 respiratory rate is normal, and here we have to increase from 15 to somewhat between 18 or 19 in order to overcome that elastic resistance. So now we will see how we can overcome this elastic resistance by increasing the respiratory rate. As you know all that when the respiratory rate is increased and the respiratory rate is increased, the breath becomes shallower, there is decrease in the tidal volume, and when there is decrease in the tidal volume, there is elastic resistance decrease. I give you example. As you can see that this is a balloon and we fill a lot of air. Here you can see that if I fill a lot of air, then there is more elastic recoil due to its elasticity. This. But if we fill comparatively less, there is less elastic recoil. So from this we can infer that by increasing the respiratory rate and decreasing the tidal volume, that is less in the shallow breaths, so we are overcoming the work of breathing in the restrictive lung diseases. So in next we will look upon the obstructive lung disease. In obstructive lung diseases like asthma or COPD, we can see that in asthma there is bronchial constriction. As you all know, and when there is bronchial constriction, there is increased airflow resistance. As you can compare it with the normal one, this is the normal one, and there you can see that the airflow resistance is increased. And you all know that here you can see when you increase the respiratory rate, the airflow resistance getting increased. Similarly, when you decrease the respiratory rate, airflow resistance getting decreased. So here you can see that this is the combined work of breathing. So there is the point where there is minimal work of breathing, that is 10. So normal is 15, that is 10. That you know that this is the actually compensatory mechanism by the body to overcome that obstructive disease causing the airflow resistance increase. So here you can see that the respiratory rate is decreased. When respiratory rate is decreased, you can infer from my whole concept that the tidal volume will increase. So when the tidal volume will increase, the constriction caused by asthma or something else will get better. As you know that there is some kind of obstruction. When you put more air, that will relieve the obstruction. So from here we can infer that the obstructive lung diseases, we have to decrease the respiratory rate and increase the tidal volume to overcome the increased air resistance. That's all for today. Thank you so much.